What do the pictures look like? So this is a snap from a full field. You can see these cells here that are cells that are not normally in a peripheral blood smear, so that are plasma cells. And if you look at the diff, so here you can see how the differential looks like. You can see that the patient had more than 20% plasma cells, so that was a plasma cell leukemia, just to give you an idea and an example. That is another example of a more tricky situation. So this patient had an hyperleukocytosis, so a very high white blood count. And you can see here on the full field that there are cells that do not belong into the peripheral blood. If we have a closer look at the differential, so they look a little bit like blasts. So the AI identified some of them as blasts and some of them as atypical lymphocytes, but then we decided to put them all together as blasts, but we wrote the comment that we're not sure if it's a more mature lymphoid neoplasm that looks blastoid or if it is a acute leukemia that looks a little bit mature. But what I want to show here, you can write your conclusions and your recommendations. For example, here the recommendation was to do a immunophenotyping by FACS analysis. You can write everything in a Scopio system. You can really finalize your report in one tool, and then you can sign it off, and then everything is pushed into the LIS. So this case that I've shown you was at the end blastoid mantle cell lymphoma. So at the end, the Scopio system has been better than we have been because we overruled the system and told them that all the atypical lymphoid cells are blasts. So Scopio, in fact, has been better than we have been.